The adductor brevis is one of the short adductor muscles of the medial thigh compartment. It lies deep to the adductor longus and superficial to the adductor magnus. Compact and triangular in shape, it acts as an important stabilizer and mover during thigh adduction. Together with its neighboring muscles, it forms the powerful adductor group responsible for bringing the legs toward the body's midline. The adductor brevis originates from the body and inferior ramus of the pubis, located just below the pubic crest. This bony ridge provides a stable base for the muscle's fibers to emerge, angled downward and laterally across the upper thigh. From its pubic origin, the fibers run posteriorly and laterally to insert into the pectineal line and the proximal part of the linea aspera of the femur. This broad insertion allows the muscle to generate both adducting and flexing forces on the thigh. The primary function of the adductor brevis is adduction of the thigh, pulling it toward the midline during activities such as walking, crossing the legs, or stabilizing while standing on one leg. It also assists in hip flexion, particularly in the early phase of movement, and contributes slightly to medial rotation of the thigh. During gait and athletic motion, it acts dynamically to balance opposing abductors like the gluteus medius. The muscle receives its blood primarily from the deep femoral artery, profunda femoris, through its medial circumflex and obturator branches. These vessels ensure an efficient oxygen supply even during sustained activity, preventing fatigue in prolonged postural control. The obturator nerve, specifically its anterior branch, originating from the L2 to L4 spinal segments, innervates the adductor brevis. This nerve passes through the obturator canal and often divides to send fibers both anterior and posterior to the muscle, highlighting its deep anatomical position as a boundary between the nerve's two divisions. Tightness or overuse of the adductor brevis can contribute to groin strain or adductor tendinopathy, common in athletes such as soccer or hockey players. Pain or weakness in this muscle may also mimic hip joint pathology, so precise palpation and imaging are important for accurate diagnosis. To summarize, adductor brevis originates from the body and inferior ramus of pubis and then inserts to pectineal line and proximal linea aspera. It is supplied by branches of the deep femoral and obturator arteries and anterior branch of the obturator nerve. It adducts thigh, and assists in flexion and medial rotation. The adductor brevis, though small, plays a vital role in thigh control, stability, and coordinated movement, bridging the deeper adductor system with surface-level muscular activity. Thanks for watching. If you found this video helpful, don't forget to like and subscribe for more content on anatomy and health. See you next time.